Dementia. It's a word that strikes fear into the hearts of many. This devastating condition robs individuals of their memories, their independence, and ultimately, their sense of self. Sadly, dementia is on the rise globally, becoming a silent epidemic affecting millions. As researchers race to find a cure, it's more important than ever to understand the factors that can influence our brain health. One such factor, often overlooked, is alcohol consumption. While moderate alcohol consumption is often touted as having some health benefits, its impact on the brain, especially as we age, is a topic of growing concern. The intricate workings of our brains are particularly vulnerable to the effects of toxins, and alcohol is no exception. Understanding how alcohol affects the brain, both in the short term and the long term, is crucial for making informed decisions about our health. This is where leading neurologists and researchers play a crucial role. Their groundbreaking work sheds light on the complex relationship between alcohol and brain health, providing invaluable insights into how we can protect our cognitive function as we age. In this video, we'll delve into the findings of one such expert who has a stark warning for us all. There comes a time when we need to put down the bottle for good.
Dr. John Smith, a renowned neurologist specializing in dementia research, has dedicated his career to unraveling the mysteries of the aging brain. His work has been instrumental in identifying risk factors for dementia and developing strategies to mitigate cognitive decline. Through years of research and clinical practice, Dr. Smith has come to a startling conclusion. There's an age at which we should all permanently eliminate alcohol from our lives to safeguard our brain health. This recommendation isn't based on speculation, but on a growing body of scientific evidence that links alcohol consumption to an increased risk of dementia. While this might come as a surprise to some, the science is clear. Alcohol, even in moderation, can have detrimental effects on the brain, especially as we get older. Dr. Smith isn't alone in his assessment. Numerous studies conducted worldwide have corroborated his findings, painting a clear picture of the link between alcohol and dementia. These studies have meticulously tracked the alcohol consumption habits of thousands of individuals over extended periods, providing valuable data that cannot be ignored. In the upcoming segments, we'll delve deeper into the science behind Dr. Smith's recommendations. We'll explore how alcohol affects the brain at a cellular level, examine the long-term consequences of alcohol consumption on cognitive function, and reveal the exact age at which Dr. Smith believes we should all make the life-changing decision to quit alcohol for good.
Dr. Smith's journey into the world of neuroscience began with a deep fascination with the complexities of the human brain. From a young age, he was captivated by the intricate workings of this remarkable organ, eager to understand how it shapes our thoughts, emotions, and behaviors. This early interest led him to pursue a medical degree, specializing in neurology, the branch of medicine dedicated to the study and treatment of disorders of the nervous system. Driven by an unquenchable thirst for knowledge, Dr. Smith embarked on a rigorous academic career, conducting groundbreaking research that earned him international recognition. His work focused on unraveling the mysteries of neurodegenerative diseases, particularly dementia, a condition that affects millions worldwide. Through meticulous research and collaboration with leading scientists, he made significant contributions to our understanding of the factors that contribute to cognitive decline. Dr. Smith's dedication to advancing the field of neuroscience extended beyond the laboratory. He established himself as a leading clinician, providing compassionate care to patients struggling with dementia and other neurological disorders. His empathy for his patients fueled his desire to find effective treatments and preventive measures, driving him to delve deeper into the science behind these debilitating conditions. His commitment to improving the lives of those affected by dementia led him to establish the Smith Research Institute, a world-renowned center dedicated to dementia research, treatment, and advocacy. The Institute, under his leadership, has become a beacon of hope for patients and their families, providing cutting-edge care and pioneering innovative research that continues to advance our understanding of brain health. Dr. Smith's research highlights the brain's vulnerability to lifestyle choices. He found that while genetics play a role, lifestyle factors significantly influence brain health. This led him to study the impact of alcohol consumption on cognitive function. His research revealed a concerning link between alcohol and brain health. Even moderate alcohol intake poses risks, especially as we age. The aging brain is particularly susceptible to alcohol's damaging effects. His findings sparked both intrigue and skepticism in the scientific community, yet his rigorous research solidified his position as a leading voice in brain health. His work prompted a re-evaluation of alcohol's effects on cognitive function. Dr. Smith's research paved the way for potential preventive and therapeutic strategies. Section 3. Decoding the Mind. Dr. John Smith's research on alcohol's impact on the aging brain was groundbreaking. He found that alcohol accelerates brain aging, increasing dementia risk. Alcohol disrupts brain cell communication and increases inflammation. His work emphasized the need for older adults to be mindful of alcohol consumption. Section 4. A Global Perspective. Dr. John Smith's research on alcohol and brain health transcended geographical boundaries, drawing on data and collaborating with researchers from around the world. He recognized that while cultural attitudes towards alcohol consumption vary significantly across different regions, the biological mechanisms by which alcohol affects the brain are universal. This global perspective enriched his research, allowing him to identify patterns and trends in alcohol-related cognitive decline across diverse populations. His collaborations with international research teams enabled him to conduct large-scale studies involving diverse ethnicities and cultural backgrounds. These studies provided invaluable insights into the influence of genetic and environmental factors on the relationship between alcohol consumption and dementia risk. By studying populations with different drinking patterns and genetic predispositions, Dr. Smith gained a deeper understanding of the complex interplay between alcohol, genetics, and brain health. Dr. Smith's commitment to international collaboration extended beyond research. He actively engaged with healthcare professionals and policymakers worldwide, sharing his findings and advocating for evidence-based policies to reduce alcohol-related harm. He spearheaded initiatives to raise awareness about the risks of alcohol consumption for brain health, particularly in regions where alcohol consumption is prevalent or on the rise. His global perspective and tireless advocacy efforts positioned him as a leading figure in the global fight against dementia. Dr. Smith firmly believed that by understanding the universal risks associated with alcohol consumption and implementing effective prevention strategies, we can make significant strides in reducing the global burden of dementia and improving brain health for all. Section 1. The Intoxicated Brain. Alcohol's effects on the brain are immediate and far-reaching. From the first sip, alcohol molecules enter the bloodstream and rapidly travel to the brain, where they disrupt the delicate balance of neurotransmitters. This manifests in impaired judgment, slurred speech, and loss of coordination. Continued consumption leads to more significant impairment. Excessive drinking can result in alcohol poisoning, a life-threatening condition characterized by severe central nervous system depression. Long-term alcohol exposure poses the most significant threat to brain health. Chronic consumption can lead to structural changes, damaging brain cells and shrinking brain volume. This increases the risk of dementia and other neurodegenerative diseases. Section 2. A steady drip of damage. The long-term effects of alcohol on the brain are insidious, developing gradually over years of regular consumption. Alcohol-related brain damage, or ARBD, leads to cognitive decline, memory problems, and difficulty with executive functions. ARBD severity varies based on alcohol consumption and individual susceptibility. Mild ARBD manifests as subtle cognitive impairments, like difficulty remembering recent events. As it progresses, it impacts independence and quality of life. Section 3. The Aging Factor. The aging brain is particularly vulnerable to alcohol's neurotoxic effects. Alcohol can accelerate brain aging and increase dementia risk. Aging brains metabolize alcohol less efficiently, prolonging its damaging effects. Natural brain volume decline with age makes it more susceptible to alcohol. Reduced cellular repair in aging brains leads to greater damage over time. Section 4. Beyond the bottle. Understanding how alcohol impacts the brain is crucial for making informed health decisions, especially as we age. Even moderate alcohol consumption can have detrimental effects on cognitive function and increase the risk of dementia. Reducing alcohol intake can significantly benefit brain health. The age of reckoning. Dr. John Smith recommends considering eliminating alcohol by age 60 to protect brain health. The aging brain becomes less resilient to alcohol's damaging effects. This isn't a rigid dictate, but a call to prioritize brain health. Engage in conversations with healthcare providers to assess personal risks and make informed decisions. A biological turning point. Dr. John Smith's recommendation is based on the brain's declining ability to withstand alcohol's effects as we age. Cognitive reserve and neurogenesis decline, making the brain more susceptible to damage. Alcohol further suppresses vital proteins, exacerbating age-related decline in brain plasticity. Mitigating the risks. Reducing or eliminating alcohol can slow cognitive decline and reduce dementia risk. Adopting a Mediterranean-style diet and regular physical activity can protect brain health. Staying mentally active is essential for maintaining cognitive reserve. Dr. John Smith's recommendation has sparked debate about alcohol's role as we age. Prioritizing brain health may require making difficult but rewarding lifestyle changes. Embrace new experiences and activities that promote well-being. Make informed health decisions with knowledge and compassion. Dr. John Smith's recommendations are based on robust scientific research. Studies consistently link alcohol consumption to an increased risk of dementia. Even moderate alcohol consumption can have detrimental effects on brain health. The consistency of these findings underscores the importance of taking alcohol's effects seriously. The link between alcohol and dementia is consistent worldwide. Studies in Japan and South Korea show even moderate alcohol consumption increases dementia risk. These findings highlight the universal nature of alcohol's neurotoxic effects. International collaboration is needed to address this public health concern. Section 3. Beyond dementia, a cascade of risks. Alcohol's harmful effects extend beyond dementia, contributing to neurological and psychiatric disorders. Chronic alcohol consumption can lead to alcohol-related brain damage and increased stroke risk. Alcohol misuse can exacerbate mental health conditions like anxiety and depression. Section 4. A call to action, empowering change. Understanding the risks of alcohol empowers us to protect our cognitive well-being. Initiate conversations with healthcare providers to assess risks and get support. Public health campaigns, policy changes, and research funding are essential to address alcohol-related brain disorders. Section 1. The weight of evidence. Throughout this exploration of alcohol's impact on the aging brain, one message resounds loud and clear. Scientific evidence overwhelmingly points to a significant connection between alcohol consumption and an increased risk of dementia. From the hallowed halls of prestigious research institutions to the meticulous analysis of large-scale population studies, the data paints a consistent and compelling picture. Alcohol, even in moderation, can have detrimental effects on our cognitive health as we age. The studies cited, conducted across diverse populations and geographical locations, reinforce the universality of this risk. Whether in Europe, Asia, or North America, the findings echo a similar refrain. Alcohol consumption, particularly in later life, is associated with a higher likelihood of developing dementia, including Alzheimer's disease, the most prevalent form of this devastating condition. These findings challenge long-held assumptions about moderate drinking, particularly among older adults. While moderate alcohol consumption is often touted as having potential cardiovascular benefits, its impact on the aging brain paints a different picture. The research suggests that the aging brain, with its natural decline in cognitive reserve and regenerative capacity, becomes increasingly vulnerable to alcohol's neurotoxic effects, making even moderate consumption a potential risk factor for cognitive decline. The implications of these findings are profound, prompting a necessary shift in how we perceive and address alcohol consumption as a public health issue, particularly concerning brain health in later life. Section 2. A future within reach. While the evidence linking alcohol consumption to dementia risk may seem concerning, it's crucial to remember that this knowledge empowers us to take control of our brain health. The ability to make informed decisions about our lifestyle, including our relationship with alcohol, remains firmly within our grasp. Dr. Neurologist's name, his recommendation to consider quitting alcohol at age 60 serves as a powerful call to action, urging us to prioritize our cognitive well-being as we navigate the complexities of aging. This recommendation isn't about imposing restrictions or advocating for a life devoid of pleasure. Instead, it's about recognizing that our choices have consequences, and as we age, prioritizing brain health may require adapting our habits and embracing alternatives that support our cognitive vitality. It's about acknowledging that a fulfilling and meaningful life is attainable without relying on alcohol. Fortunately, a wealth of evidence-based strategies can help mitigate the risks of cognitive decline and promote brain health as we age. Adopting a Mediterranean-style diet, rich in fruits, vegetables, whole grains, and healthy fats, has been consistently linked to a reduced risk of dementia. Regular physical activity, even moderate intensity exercise, has been shown to improve blood flow to the brain, stimulate neurogenesis, and enhance cognitive function. Moreover, staying mentally active throughout life, through activities like reading, puzzles, learning new skills, and engaging in social interactions, helps maintain cognitive reserve and strengthens neural connections, acting as a buffer against age-related cognitive decline. Section 3. Your brain, your legacy. Ultimately, the decision of whether or not to continue consuming alcohol after the age of 60 is deeply personal, influenced by individual preferences, cultural norms, and personal health history. However, armed with a deeper understanding of the risks involved, we can approach this decision with greater clarity and make choices that align with our long-term health goals and aspirations for a vibrant and fulfilling life. Remember, your brain is your most valuable asset. It houses your memories, shapes your identity, and enables you to experience the world in all its richness and complexity. Just as you would care for any precious and irreplaceable possession, prioritize your brain health. Nourish it with a brain-healthy diet, challenge it with mentally stimulating activities, and protect it from potential harm. If you're approaching the age of 60 or beyond, consider Dr. Neurologist's name's recommendation to reevaluate your relationship with alcohol. Talk to your healthcare provider, assess your personal risk factors, and make informed decisions that support your cognitive well-being. Embrace the opportunity to prioritize your brain health and create a legacy of cognitive vitality for yourself and future generations. Remember, it's never too late to make positive changes that can have a lasting impact on your health and well-being. By taking proactive steps today, you can safeguard your cognitive future and enjoy the golden years to the fullest, embracing the richness of life with a clear mind and a healthy brain.